The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we're going to be speaking with John Hannigan, who is the Regional Director for CMS, which is the Center for Medicare and Medicaid Services. And he's going to be telling us all about the changes that happened to Medicare and Medicaid at the end of the COVID-19 pandemic's public health emergency status. There are all sorts of changes that you want to know about, so make sure you stay tuned to Aging Horizons as we go through that important information, so stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
Receiving help for Ella has been life-changing, and the best word for it is relief. I was the therapist, I was the aide, and I couldn't be the mom because emotionally you're just to your wits' end, you're trying to survive.
I provide care for the Harrises, specifically their daughter Ella. Respite care is extremely challenging, but the rewards that you receive from it are 100 times more than working with a child that doesn't have special needs. Once they get something, it's everything. It's a you celebrate. You don't just enjoy those moments. You celebrate every moment that you get, that you guided them to that next step.
Respite. It's okay to need it. It's okay to want it. Will you provide it? Call 800-224-6034 or visit respite.mt.gov.
It went from survival to enjoying life and being able to be a mom again.
Brought to you by the Montana Broadcasters and this station.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we have a very special guest with John Hannigan, who is the Regional Director for CMS, which is the Center for Medicare and Medicaid Services. John, thank you so much for being with us today. It's wonderful to get to chat with you about all of this important information that's coming out around about the end of the COVID-19 public emergency status. So thank you for being with us.
Thank you. Pleasure to be here.
Can you tell me a little bit about what CMS is and what it does for the American consumer?
Yes, of course. Well, CMS is the Centers for Medicare and Medicaid Services. It's underneath the Federal Department of Health and Human Services. And as it says, Medicare and Medicaid Services. So we oversee and administer those very, very large programs of Medicare, normally for those age 65 and older, end-stage renal disease, and some other people that are eligible for Medicare. Medicaid, which is state-run programs,
Sure.
However, they share funding through the federal government. And then there are other components like the federally facilitated marketplaces and other health care.
And you work in the regional office, so is that just Montana, or what other states are in that office?
So I sit in Denver and work out of the Denver regional office. We cover 6 states, including Colorado, Utah, Wyoming, Montana, North Dakota, and South Dakota. A huge geographic region with some sparsely populated states with a lot of rural area.
That's amazing, and so many great people in that area, and I'm glad that you got to come to Montana and get to be on this program with me. I really appreciate it. So let's talk a little bit about the end of the public health emergency status. What does that mean for Medicare and Medicaid?
Well, it means a lot. The Secretary didn't continue the public health emergency. Significant changes happened in response to COVID-19, like everyone else in the country. But being a large healthcare organization, massive changes to us, a very, very quick response to COVID-19, where we implemented hundreds of what we call waivers and flexibilities. You know, the program has statutory regulations and many, many rules, complex program, but we were able to waive many of those rules under emergency authorization, with the key being to get health care to as many people as possible across the country. And I think we saw that happen.
Right, in an unprecedented time in American history to be able to roll those changes out so quickly.
That's right.
And then May 11th, correct, came, and now we're starting to do some transition to different requirements. And what is that going to look like?
Yeah, that's absolutely correct. So I think we'll cover a couple different areas, and we'll start with the Medicare piece, because sometimes people get confused with both of those things. But on the Medicare piece, and these are people with Medicare, and this can be traditional Medicare Part A and B, or Medicare plans Part C, managed care plans, but some of those things will change, because the regulations that were in place prior to the pandemic were there for a good reason, to ensure the health and safety of people and people with Medicare. So we had flexibility to those rules, and now as we come out of the pandemic, it's time to go back to those rules. However, we learned a lot, and there are some instances where we implemented things that are just very good ideas, and we've evaluated and built those into the program. We're still evaluating a few of those things, like telehealth, that may continue, or at least portions may continue forward.
Sure, absolutely. And that deadline for when they're going to start making decisions about telehealth is now pushed out to 2024,
That's correct, the end of 2024.
And then I'm sure CMS and Medicare in general will be letting beneficiaries know as that telehealth benefit changes what those steps are going to be to their plans.
Yes, absolutely. It's a combination of congressional legislation and our rules, and as they get implemented, we'll be certainly let everyone in America know.
Absolutely. So another part of the major changes that we had to during the COVID pandemic were obviously the vaccines and the treatment for COVID-19. What are the changes for vaccines, for example?
Well, the good thing is everyone will still get vaccines free of charge, at no charge whatsoever. There are some slight changes on the testing piece. Those people with Medicare that are in traditional Medicare will continue to get the PCR testing free of charge, but people with Medicare Advantage plans, those are managed care plans, they may have some cost share, but they'll need to check with their plans, and that's going to be a consistent. If you have a plan, they'll need to check with them.
Absolutely. So making sure that you contact the provider of your own plan, not just Medicare directly.
That's correct.
Wonderful. And then what about those the treatment for COVID-19? How is that going to be affected?
Treatment doesn't change.
Sure.
If someone has COVID-19 before or after the end of the pandemic, they're going to get treated, and if they had any cost sharing prior, that would be the same depending upon their status and what type of plan they have.
So again, if they have those Medicare Advantage plans, they're going to want to check in with those. But generally, the hospital care, things like that, are going to stay consistent.
Correct.
That's wonderful. When we come back, I want to talk about how Medicaid has changed, because I assume that those changes are pretty different from the way that Medicare has changed. Okay, just as an overview one more time before we switch into Medicare, when you are talking about the Medicaid, when we're talking about Medicare, your Part A, your Part B, that's going to stay the same. The only thing we want to check about is our Medicaid part, or Medicare Part C, correct?
That's correct.
Okay, wonderful. And those vaccines that we were getting before, we're still going to be able to get those?
Correct.
Wonderful. Okay, so when we come back, we're going to talk about the changes to the Medicaid program. These are a little bit different rules and regulations. There is the Child Health Insurance Program and also Medicaid for Adults. So we're going to look at how those two programs have changed based on the rules and regulations that have sunsetted after the COVID-19 public health emergency period has ended. So make sure you stay tuned, and we'll be right back.
so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
With as many as 1 in 10 Americans at risk for Alzheimer's or some other form of dementia, chances are someone you know and love will receive that diagnosis. When that happens, you may well feel devastated, but know that you are not alone. Help is available. You don't have to face dementia by yourself. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
It's been 27 years. I never thought I'd still be smoking, but here I am, COPD and all. I'm about to have a granddaughter. There's so much to show her, but I'm scared I won't be able to keep up like I used to. I kind of gave up on myself on quitting. But it's different now. I want to be here for her and for my daughter.
This is Sergeant Jones. Please respond. I was separated from my squad. Requesting backup. Anyone? Please respond. I'm all alone here.
Welcome back to Aging Horizons. Today we're speaking with John Hannigan, who is the Regional Director of CMS, which is the Center for Medicare and Medicaid Services. And we are talking about all of the changes that have happened to Medicare and Medicaid during the end of the public health emergency of COVID-19. So, John, we've already talked about Medicare and the changes that happened there, but let's talk a little bit about Medicaid. What are some of the major changes that we can see now moving forward with Medicaid?
Well, major changes happened to Medicaid with the initiation of the public health emergency.
Sure.
As you know, we discussed Medicaid as a state-run program. Multiple people in the states, they normally would have an annual renewal process to be on the Medicaid or the Children's Health Insurance Program.
Sure.
But with COVID-19, we didn't want anyone getting dropped off the Medicaid rolls.
Yeah.
So the federal government asked or directed all of the states to do what we call continuous enrollment, to basically keep people enrolled in those programs.
Sure.
States also got federal matching funds to help run those programs. Well, congressional action in conjunction with the end of the public health emergency determined that states need to go back to normal operations and do those renewals.
Sure.
So starting in April, states are able to start that redetermination process.
And that redetermination process is going to start with, what does it look like for the consumer? What's the first step?
In most cases, the individual will receive a letter.
Okay.
And the letter will be requesting demographic information, other information, similar to what would have been a normal annual renewal to determine their eligibility for the state program.
And that's a letter that people need to be paying close attention to, is that correct?
They absolutely need to pay attention to. They need to go to their mailbox, they need to make sure they open that, and they make sure they fill it out properly.
And if folks haven't received a letter, what should they do? Should they assume, I'm good?
They should not assume that they're good. We hope that everything works effectively.
Sure.
But even if anyone has a question, they can go to the website, I believe will be displayed on the screen, and there is a form there, and they can fill in and update their information on the state website.
And what's the main reason that people aren't receiving these letters?
Well, people don't Well, I don't know if they're not receiving them, or they're not seeing them, or they're not reading them.
Sure.
Snail mail in this day and age, we get a lot of mail. Maybe they don't recognize what it is. Maybe they've moved. There could be a variety of reasons that somebody doesn't respond to a paper letter.
Sure, so maybe they just have bad contact information in the system.
That's right.
And updating those addresses is so important for folks, right?
That's right.
Absolutely. Okay, and that happens both for adults who are on Medicaid, but it also happens with the state program for children, the Children Health Insurance Program?
That's correct. I believe it's Montana Healthy Kids.
Sure.
So any individual, it should be a similar process. They should get that letter, and if we don't get one, then go proactively and check the website. And this is not family or individual specific. If one person in the family returns and is deemed ineligible, that doesn't apply to everyone. Each person should respond and make sure their information is updated.
Oh, that's so helpful, so important to know that just because one person has become ineligible doesn't mean the entire family has.
That's correct.
And if folks are, you maybe don't have access to the internet, can they contact a local SHIP counselor, someone like that?
Absolutely. The SHIP counselors are available and willing to help, and they're wonderful people. They do a great job.
And we've talked about that, the Children's Health Insurance. Is there a place where folks who are enrolled in Children's Health Insurance can go? Because I know a lot of those SHIP counselors are located at area agencies. Can they also reach out to SHIP counselors as well?
They sure can. The SHIP counselors, I believe they will help anything. As I said, wonderful people. They live and work in your community, and they really do want to help make sure that no one loses their coverage.
Wonderful. They are just some of my favorite people, those SHIP counselors. We get some on the Aging Horizon sometimes, and they're just so great. Is there anything else that we've missed that you want to talk about the Medicare and Medicaid changes that we've gone through?
I don't think we've missed anything. I just want to re-emphasize that it has been a learning experience for everyone. We had very good foundational programs and processes in place, and we've learned. The COVID-19 pandemic was very challenging for everybody, but there is a bit of a silver lining in the sense that we've learned lessons. We will incorporate those into our programs going forward. And in conjunction with the states on the Medicaid side, we'll continue to do as much as we can to increase access and health care for everyone.
This is a really important time in history to really be checking in with your providers, with your Medicare Advantage plans, to make sure that you're staying on top of the changes that are going to come out in the next few weeks, because we've made these big changes, but it's possible that some more changes might come in 2024. We talked about like the telehealth.
That's right.
Yep, so it's important to just be paying a lot of attention and reaching out to your SHIP counselor. If you haven't spoken to them recently, give them a call. One of the things that I think we noticed as part of the COVID-19 public health emergency is that there was a rise in fraud, both in Medicare fraud and just fraud in general. And that is one thing that CMS is involved in, correct?
Certainly. We have a very large department that combats fraud, and you can imagine the volume of health care and dollars that Medicare oversees. Fraud has always been with us. There are bad actors that will exploit the program. What we've seen recently with COVID specifically is there will be tests mailed to the individual's home and billed underneath their Medicare ID number. It's very hard to determine. With either those type of tests or any equipment or supplies, if someone gets them and they have not been ordered, they can call 1-800-MEDICARE, report that immediately. They can even call their local police. If someone feels that their Medicare beneficiary ID has been stolen or their identity has been stolen, they need to let someone know very, very quickly.
Wonderful. When we get back, we're going to talk a little bit more about what CMS can help do about fraud and some of those things to look out for if you believe that you have been a victim of fraud. So make sure you stay tuned.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on. But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Today, class, we'll be discussing the term ombudsman, a word we borrowed from the Swedes and never gave back. Say you're a resident or you have a loved one in long-term care. Now, what do you do if you're not happy with the care and services you receive? You call your long-term care ombudsman, of course. Your ombudsman is available to support you and your rights. An advocate on your behalf could be the ticket. This is your home. If you have questions, the numbers right there below me have all the answers. Class dismissed.
I was diagnosed with diabetes in 1992 and I went into denial. It made me angry. I was a professional chef and I didn't want to change my eating style. It took me a long time to get serious about managing my health. My perspective changed from resentment to one of loving my body, the container for my spirit. Getting help from my diabetes educator supported my goals of improved self-care. I want to feel good and have a great life. My diabetes educator helps me do this.
More fuels, more fires, more fear. You don't have to live in the forest to be threatened by wildfire. In 18 years, the number of fires per year has increased by 1,000 and tripled the acreage burned. Turn it around. Advocate for forest management. Form a group. Craft a plan. Mitigate the fire hazard. You and your community can't dismiss the trend, but you can mitigate the risk. FireSafeMT.org can help. Paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
Welcome back to Aging Horizons. Today we are speaking with John Hannigan, who is telling us all about the changes that have been made to Medicare and Medicaid after the public health emergency from COVID-19 has ended. So, John, we talked about the Medicare, we talked about the Medicaid, and we just started to talk a little bit about some of the fraud that happened through the COVID-19. One of the biggest things that we saw in Montana is a lot of those durable medical supplies or the COVID testing supplies being mailed. Can you talk a little bit about that?
I sure can. If somebody receives a service or a product that they didn't order, they should report that. If you're not sure, you can take your bill, you can call the Senior Medicare Patrol, and you can sit with somebody and they'll walk through that bill and help you be sure. But if you know for certain that you have been a victim of fraud, the first thing you should do is report that to 1-800-MEDICARE.
Okay, well, absolutely. And then one of those, what are some of the signs that you might be being a victim of fraud and that you're not talking to even a durable medical equipment company?
That's right. CMS will not call someone. Normally, communications will come through official channels via letter, or you will contact them, it will come through your provider. Anytime somebody provides pressure, we don't provide pressure, we don't try to sell products. That could be somebody who is a bad actor trying to pressure or trick somebody into doing something that's not in their best interest.
So CMS is never going to arrest you. They're never going to send out an arrest warrant for you or anyone else.
That is correct. If someone is being threatened with anything that is detrimental, if they're threatened with collections, that they're going to lose some type of benefits, anything harmful to them, especially if that comes in a call, that is probably fraud or a scam.
And is CMS or Medicare ever going to call and ask for a credit card number or a prepaid Visa card?
Clearly, across the board, we shouldn't be giving out our credit card numbers to anyone that calls. That also applies to our Medicare beneficiary ID.
Sure.
We should treat that number as we would our Social Security number or our credit card numbers. They're very valuable to bad people.
Absolutely, and so you don't want to be answering those questions over the phone, not giving out that information. And if someone is going to reach out to you from a government agency, they probably already have that information in front of them already.
Correct.
Wonderful. So it just generally, a lot of those prepaid Visa scams, a lot of those iTunes cards, those are not legal tender that you can pay the U.S. government with.
They
correct?
are not. We do not accept them. And generally, if you hear those terms, that's a bad idea.
Absolutely. And that Senior Medicare Patrol, one of the things that Renee Liberi-Shanks has always said is really read your statements. And that has been so helpful for a lot of the seniors that we work with. It's just looking at those statements. Medicare does such a great job of telling you what you're paying for. So
that's true. We do try, but they can still sometimes be confusing, and that's where the Senior Medicaid Patrol comes in, because they are people that you can sit down with, actual humans. They'll help walk you through that.
Absolutely. So when we are looking at this unwinding process about these changes, some of the takeaways for today is ask a lot of questions. And remind me again, where can we go for resources if you have questions about what's going to happen to your benefits through Medicare?
Through Medicare, you can always call 1-800-MEDICARE.
Okay.
We do have a Medicare website, medicare.gov. But for some people that don't want to navigate and search around, call 1-800-MEDICARE. We have people standing by all the time that can answer questions and help.
Absolutely. And then you can also get that help through a local SHIP counselor, correct?
That's absolutely correct. The SHIP counselor, and then as we discussed also, the Senior Medicaid Patrol.
And for the Medicaid unwinding, we really want to make sure that our information is up to date. And where do we do that?
That's directly run by the state.
Okay.
There is the website, which is displayed, and it also has a phone number that you can call.
And it's so important to be updating that information so that you're getting those letters and that you can respond in a timely manner. How long do folks have to respond to those letters?
I'm not sure exactly what the state is giving them to respond, but I know the state is doing this on a monthly basis.
Absolutely. And this is a different process in every state,
That's
I
right.
assume. That's right. Okay. And then when we are looking at those programs, if one member of your household has been determined ineligible, that doesn't mean that everyone else should throw away their letters, right?
Absolutely not. There are different programs for adults and for children and qualification criteria, so make sure that everyone's information is updated.
That's so important, so important, because we don't want people losing health care in this time or in any time.
That's
we
right.
just want to make sure that people are getting those services. And then if you are getting billed for something that you believe should be covered by Medicare, we are going to reach out to the S&P program and to the 1-800-MEDICARE.
That's absolutely right.
And they can go over the services that are and are not covered with you.
Correct.
And then if we're feeling like fraud is happening, we're going to contact the police, we're going to contact our local SHIP counselor maybe, and go through those with them. And again, what are we never going to give out to folks on the call?
Credit card number, Medicare beneficiary ID, Social Security number, or really any other personally identifiable information that can be used to gain some of those other things.
That is so important. You know, we've seen such an uptick in Montana, and I'm sure all over the 6 states that you cover, there's just so much fraud going around these days. I really think that it is so wonderful that you came out to see us in Montana. We really appreciate you coming here. And folks at home, if you still have questions about what to do about your Medicare or Medicaid benefits, you have those resources in your community. We've spoken to so many wonderful SHIP counselors on this program, and you know where to get that information. We're going to put that number up on the screen. That number is going to route you directly into your community. So no matter where in Montana you give a call, you're going to be talking to someone local. If you need help reading your Medicare statements, if you're concerned that something you've been billed for was fraud or was inaccurate, make sure you contact the Senior Medicare Patrol, because they can really, really help you read through those statements and get you that accurate information that you're looking for. And make sure that information is up to date online on those websites that we talked about, because you do not want to be missing these letters. You want to make sure that they're returned in a timely fashion so that you can continue your benefits or understand what your options are moving forward. Thank you so much for staying tuned with us to Aging Horizons. We hope that this has been an informative information, and again, make sure you check out those websites to get any and all information related to the Medicare programs changing through the end of the public health emergency. Thank you so much for staying tuned.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.